Thank you for viewing my poster on trends in urological injuries following gynecologic oncological surgeries in Kingston. My name is Sasha Letourneau, and I am in the Queen's Medical School class of 2021. I had the pleasure of working on this project under the supervision of Dr. Agarwal, along with Kristen Zamperoni in the class of 2023 and Ms. Jessica Pudwell with the Department of Obstetrics and Gynecology. Urologic injuries are common during abdominopelvic surgeries, occurring in 0.2 to 3% of all gynecological or pelvic procedures. Common urological injuries in OBGYN surgeries include bladder and ureteric injuries, as well as vesicovaginal fistulae. Until now, no studies specifically explore the incidence of urologic injuries during gynecologic oncological surgeries. Therefore, our objective in carrying out this project was first to characterize the incidence of urologic injury among patients undergoing gynecologic oncological surgery in Kingston, Ontario, and secondly, to determine risk factors associated with urologic injury at our center. We carried out a retrospective chart review, including all surgeries performed by fellowship-trained gynecology oncologists in Kingston, Ontario, from 2018 to 2019. Surgeries with very low chance of causing urologic injury, such as inguinal or femoral lymph node dissections, were excluded. We used descriptive analysis to determine incidence and statistical analysis to compare characteristics of the injury versus non-injury groups. Our preliminary results showed that our study included 291 surgeries, where 14 or 4.8% resulted in a urologic injury, as evidenced in Figure 1. Figure 2 shows that of the 12 bladder injuries, only 2 were intentional. Table 1 summarizes the differences among injury versus non-injury groups. Most notably, key baseline characteristics, including age, BMI, and mass size, were not statistically different between the two groups. Figure 3 shows a breakdown of urologic injury outcome based on mass type and mass location. Urologic injury most frequently occurred in cases where the mass turned out to be malignant and in cases of ovarian cancer. In conclusion, further data analysis is ongoing. However, we have shown that the incidence of urologic injury among patients undergoing gynecological oncologic surgery at KHSC is slightly higher than the incidence reported in the literature. This is likely attributable to high surgical complexity and anatomical distortion, which is more common in the oncological population. Identification of potential risk factors for urologic injuries and gynecologic oncological surgery may increase awareness and decrease injury incidence, improving patient outcomes. Finally, I would like to thank our patients without whom this work would not be possible.